Hi, everybody. Welcome back to UWorld's Next Gen NCLEX review session. My name is Jackie, and I'm a nurse here at UWorld. We're so glad to have you guys with us today. We are going to be covering musculoskeletal questions. So if you guys are new to these question drill sets, what you can expect is we'll pull up a question, I'll read the question and the options, give you guys about 30 seconds to answer, and then we will walk through why the correct answer is right. So we'll kind of keep a good cadence to these and chat a little bit about the subjects as we go, but we're so glad to have you guys with us today. Make sure you guys use the chat, ask us any questions, share your success stories. Samantha is moderating the chat for us today. So with that being said too, everybody make sure you're following us on your favorite channel and share this session if you're able to. The more the merrier. We want to grow our UWorld nursing community. So we're glad to have you guys with us today. All right, let's go ahead and jump in. We'll pull up our first question. The question says, the nurse is caring for assigned clients. The nurse should first assess the client who, option 1, has a femur fracture and altered mental status. Option 2 has a hip fracture and a discrepancy in leg length. Option 3 has osteomyelitis and reports pain rated as 9 on a scale of 0 to 10. Option 4 had a lower leg amputation and reports paresthesia in the amputated foot. All right, 30 seconds on the clock. Go ahead and drop those answers in the chat. Let's see what we're coming up with. And also, we have a great events page available, so we'll have the link available for you guys in the chat, but go ahead and take a look at that. It has a great lineup of all of our live content, as well as some links to some of our frequently visited pages on our UWorld Nursing website. So we hope it can be helpful for you guys, and you can get a good glimpse of what we'll be covering. All right, I'm seeing a bunch of correct answers. Good work, you guys. I'll give you about 5 more seconds, and then we will walk through everything. But well done, you guys. Good work, good work. All right, so our correct answer, you guys did awesome, is option 1. So again, when we see that word first, this is going to indicate this is a prioritization question. So we are going to prioritize our options. We're going to use like an ABC strategy when we're looking at these. So airway, breathing, circulation. After that, we're going to worry about infection and safety. So what we're seeing in option 1 is our priority. This is our priority finding. It's indicating a complication versus what's expected in some of these other conditions. So what we're seeing in this client is signs of a fat embolism. So fat embolisms happen when we have a break in some of our bigger bones, our longer bones, like our femur. And what happens is a globule of fat can travel through our vascular system, and wherever it ends, just like what we would think of like a DVT embolizing, it's going to obstruct blood flow, restrict blood flow, and a lot of times that's going to surface in some of our critical organs like our heart or our brain. So if we know somebody has a fracture in one of their big long bones like their femur, and they're showing signs of impaired perfusion to their brain like altered mental status, we're definitely going to worry about a fat embolism, and we're going to want to assess this client immediately, notify the healthcare provider, and be sure we're doing our interventions for them appropriately. Some of the hallmark sign of fat emboli or embolism is the presence of petechiae, and this is again going to result when we have some of that clotting and obstruction to our blood flow. So good work, you guys. You did awesome on that one. Let's go ahead and move on to question 2. And be sure you keep track of how you do on these questions. Let us know how you do out of 8 at the end. All right. Question 2. The nurse is observing a staff member caring for a client who has compartment syndrome. Which of the following actions by the staff member would require the nurse to intervene? Select all that apply. Option 1, elevating the affected extremity above the level of the heart. Option 2, assessing for a distal pulse in the affected extremity. Option 3, preparing supplies for a fasciotomy of the affected extremity. Option 4, placing cold compresses on the affected extremity. Option 5, applying a compression bandage to the affected extremity. There's a lot happening with the affected extremity. So make sure you drop those answers in the chat. Again, you'll see select all that apply, so we know we're going to have more than one right answer. Let's go ahead and see what we've got. All right, and let us know too, for all of our viewers, let us know where you are in your nursing school journey, if you're taking your NCLEX soon, if you came back to tell us that you passed your NCLEX. That's the best part of our day. So be sure you guys let us know in the chat. We want to celebrate with you and cheer you on along the way too. All right, let's see what we got. Good answers, everybody. Good work, and it's great to see so many of you guys here today. If you're just joining a few minutes late, we're covering musculoskeletal questions. So we'll have 8 questions we'll go through today, and we'll have more great content coming to you later this week, too. All right. Oh, we have someone testing on Thursday, next week, Thursday. 3rd semester nursing student, NCLEX in November. Oh, that's so good. So good to see, we're covering the whole spectrum of nursing school. Very good, you guys. Okay, so our correct answers on this one are going to be options 1, 4, and 5. So again, select all that apply, more than one right answer. We're looking for, we need to really pay attention to what this question is asking. So it's saying, what actions would require the nurse to intervene? So when we see intervene, that means that we're looking for wrong actions, things that we should not do. So our correct answers are going to be incorrect statements. I know that's kind of a mouthful and a lot to process, but we're looking for the wrong actions as our correct answers. Okay, so when we are talking about compartment syndrome, it's a limb-threatening condition. It's going to happen from increased pressure within an extremity compartment, usually from edema, like a fracture or tissue trauma, and or external pressure like a cast or a restrictive dressing. So blood vessels and nerves are going to become compressed, and it's going to impair that tissue perfusion and nerve function at the site of injury or after the site of injury. So we're going to have some signs of like neurovascular compromise. So a lot of pain that's not going to be relieved by medication, prolonged capillary refill time. So that time that it takes for color to kind of refill in our nail beds. And also some coolness, indicating that we don't have that oxygen-rich blood making its way to the kind of distal part of our extremity. So again, if this is left untreated, we're going to worry about loss of limb, we're going to worry about paralysis, and even tissue necrosis. So when we're caring for a client with compartment syndrome, we need to position the affected extremity at the level of the heart to maintain tissue perfusion. We don't want the heart to have to work harder and shoot the blood further or against gravity by having it elevated. We're also going to avoid cold application. That's going to cause vasoconstriction, and that's going to decrease blood flow. So that's why our option in option 4 is wrong. And then in option 5, compression bandages can be a cause of compartment syndrome. So we definitely want to avoid these. We do not want to apply a compression bandage in this situation. Compression bandages are typically good for situations like if lymphedema is a risk factor, like after surgery, things like that. But in this case, it's not something that's indicated. Our findings in options 2 and 3, these are things we should do for compartment syndrome. So they're going to be incorrect answers for this one. So you guys did really good on that one. Well done, you guys. Again, our correct answers, the things we need to intervene on are options 1, 4, and 5. Good work. Good work. All right. Oh, and a fasciotomy, that's another kind of intervention that we'll perform for compartment syndrome. And essentially, it's kind of removing everything above the site of compression, like, our fascia, a lot of that subcutaneous tissue, and allowing kind of the area to breathe and to have room and space. So pretty intense little bedside procedure. All right, question 3. The nurse is caring for a client who is in balanced suspension skeletal traction. Which of the following actions should the nurse take? Option 1, place the client in a side lying position. Option 2, maintain the head of the bed greater than 30 degrees. Option 3, remove the weights briefly every 2 to 4 hours. Option 4, allow the weights to hang freely off the edge of the bed. All right. 30 seconds on the clock. Drop those answers in the chat. Let us know what you think. Oh, good luck to Rosie, who's testing tomorrow on TikTok. You're going to do great, and we're glad to have you here as hopefully your last bit of learning before the big day. Good work, you guys. Awesome, awesome. Good job. Good answers coming in. All right. Good work, you guys. And for everybody, be sure you're following us on your favorite social media channel at UWorld Nursing. And again, everybody on TikTok, be sure you guys share this session. The more the merrier. We want to reach as many of you guys as possible and help grow our UWorld Nursing community. And if this is your first time here, welcome. We're glad to have you. Let us know if you're a first-time visitor to one of these question drill sets. We have tons of great live content coming to you guys throughout the week. All right. Thanks for the shares. Good work, you guys. All right. Our correct answer on this one is going to be option 4. You guys did really well on this. Again, we're looking for actions the nurse should take. So these are going to be expected things we'll see that we should be doing for like a client's plan of care for someone in balance suspension traction. So skeletal traction is going to involve like surgically inserting screws, wires, or pins directly into a fractured bone. And it's going to be applying a pulling force or traction via a pulley system and a rope, and weights. And so the pulley system allows the weights to suspend from like the foot of the client's bed, and it's going to apply a pulling force to stabilize that bone. So again, the weights have to hang freely. That's the whole point of traction. If the weights are not hanging freely, they're not doing their job, and that that counter traction that's supposed to be happening isn't going to be there. So again, what we should always have be happening is what's happening in option 4. Those weights have to hang freely. We're never going to have brief periods of, frequent removing the weights every 2 to 4 hours. We're gonna need the client in option 1 flat on their back. And again, the bed is typically low. It's flat as it can be. So again, our correct answer and that one is option 4, skeletal traction. It's all about maintaining that equal weight, pulling, having tension against the bone, pulling it, holding it stable. So that's why we want those weights to hang freely. And for all of our users or viewers already using UWorld, we have tons of great traction images that you guys can check out as well. All right, question 4, halfway mark. The nurse is teaching a client with osteoporosis who is receiving alendronate. Which of the following information should the nurse include? Option 1, ensure you take the medication with food. Option 2, lie down for 30 minutes after taking alendronate. Option 3, drink an 8-ounce glass of water with the medication. Option 4, take your other morning medications with alendronate. All right, let us know what you guys think. And again, congrats to all of our to our viewers that have passed your NCLEX. That's amazing. We love to see that. Good job, you guys. Awesome answers coming through too. Good work. All right. And let us know, too, if you guys participated on Tuesday. Samantha did an awesome lecture on antepartum conditions. So kind of everything that happens from in that 9-month period that the fetal client is developing. So she covered a lot of those big complications that happen, like gestational hypertension, preeclampsia, eclampsia, and a few others, I believe. I know I'm missing one because I remember the chart in my head and there were 4. What was it? Help. Oh, help. Yeah, the trickiest one. Yes, help. Thank you. All right. Okay, let's see what we got. Good answers, everybody. Okay, our correct answer on this one is going to be option 3. So again, when we see which of the following information should the nurse include, we are looking for the correct option, something we would want this client to know, something we should do as a nurse, or something the client should do themselves. So again, we're looking for those statements that are true. They should be included in the teaching and the client's plan of care. So alendronate is a biphosphonate medication. It's commonly used for osteoporosis or to decrease the risk of osteoporosis-related bone fractures. So how this medication works is by inhibiting those osteoclasts, which allows bone building to occur more quickly. So biphosphonate should be taken on an empty stomach, ideally 30 minutes before or 2 hours after eating to ensure optimal absorption. So that's going to kind of omit option 4. We're not going to take this with other medications. And option 1, we need to take it in without food. we definitely want to take it with a full glass of water, and we want to remain upright for 30 to 60 minutes after to promote complete passage of the medication. So we don't want to lie down for 30 minutes. We want to sit up. We want to make sure that medication makes it all the way to the stomach, that we're not having any of it is, kind of remaining in the esophagus. We don't want any reflux of the medication. So you guys did great on that one. Well done, well done. All right. Question 5. The nurse is teaching a client with gout about low purine foods. Which of the following foods should the nurse include? Select all that apply. Option 1, aged cheese. Option 2, canned tuna. Option 3, smoked turkey. Option 4, yogurt. Option 5, avocado. All right, select all that apply. Drop those answers in the chat. You're going to have more than one right answer. Oh, thank you for the viewer that remembered the fourth condition we covered in the antepartum lecture. You guys were very good listeners, so well done, well done. If you guys are new to UWorld or you're considering UWorld, we encourage you guys to check out our free trial. Again, we'll have the link available for you guys in the chat, but check it out. It's a great way to see what UWorld is all about. You can try our questions, see our explanations, our illustrations, lecture videos, note card feature. There's so much, and we know it'll help you be successful for whatever you need to use it for, whether it's nursing school or preparing for the NCLEX. So we hope you'll check it out. Again, 7-day free trial. The link is available for you guys in the chat. Just look for it. And we know you won't regret it. All right. Good work, you guys. And for anyone that's using UWorld, let us know what your favorite feature is, or if there's a feature you wish that you had in the product. We'd love to know that too. All right. Our correct answer on this one is going to be options 4 and 5, yogurt and avocado. So again, we see select all that apply. Let's take a true false approach to each of these options. So again, we're looking for appropriate foods someone with gout should eat, or that are appropriate for them to eat. So gout is an inflammatory condition caused by an ineffective metabolism of purines, which accumulate from uric acid in the blood. So as those uric acid levels increase, crystals form in the synovial fluid, which is that fluid in between our joints, and that causes a lot of warmth, redness, swelling, pain, fever, and it can eventually lead to tophi formations, which are these like visible nodules of the uric acid accumulation. So foods that are appropriate for our clients with gout are going to be low-fat dairy, avocado, nuts, legumes, fresh fruits, and vegetables. What we want to avoid are those foods high in purines, like aged cheese, canned meats, any smoked meats as well. So you guys did great on that one. Well done. All right. Question 6. The nurse is observing staff members caring for assigned clients. The nurse should intervene if a staff member is observed. Option 1, encouraging a client who had an above-the-knee amputation 6 hours ago to lie in the prone position for 30 minutes. Option 2, assisting a client who had a below-the-knee amputation 12 hours ago to move from the chair to the bed after sitting for 45 minutes. Option 3, placing a pillow under the residual limb of a client who had an above-the-knee amputation 2 hours ago. Option 4, teaching a client who had a below-the-knee amputation 24 hours ago how to perform active and passive range of motion exercises. All right, drop those answers in the chat. Let us know what you think. And good answers coming in, you guys. Way to go. Awesome, awesome. Let us know what you think. Let us know what you think. And again, let us know too, other content that you guys would like to see. We're always evolving our content calendar. We want to help you guys the best we can. And so, give us some ideas on some other content that you're interested in, whether it's like strategies, like SATA questions, priority questions, intervene questions, delegation, things like that, or if it's just topics in general. If you guys like these question drill sets, if you like more lecture content, let us know. We love to hear what you guys think. All right, I will go ahead and pull up our answer. So our correct answer on this one is going to be option 3. Again, intervene means the action that's being performed is not safe for the client. So we need to stop the action. So we're looking for the correct answer is going to be the incorrect action. So when we're talking about lower extremity amputation, either above the knee or below the knee, an important component for that rehabilitation is preventing contractures. So prolonged hip flexion causes tightening of the muscle fibers, and that can restrict our joint motion, and that can lead to pain and unsuccessful prosthesis like placement and fitting. So to prevent hip flexion contractures after amputation, the client should avoid prolonged flexion of the residual limb and or hips. So this would include things like elevation on a pillow or sitting in a chair for more than an hour. So our client in option 3, placing a pillow under the limb, that we don't want to do that. We don't want to do that at this point. What we see in option 1, laying prone, this is good for stretching that muscle, preventing that hip flexion. Option 2, again, this is appropriate. This is going to help prevent that flexion contracture. And then option 4, contraction prevention through muscle strength and mobility is definitely appropriate. We're going to want to be sure and get these clients moving as fast as we can. All right. Let's see, question 7, moving right along, 2 more. And if you guys are just joining, we'll have this session available on demand on our channels. And we are covering musculoskeletal questions to anyone that's just here. All right, the nurse is teaching a client with osteoarthritis who is reporting pain and swelling of the right knee. Which of the following information should the nurse include? Select all that apply. Option 1, avoid splinting your right knee. Option 2, perform weight-bearing aerobic activities regularly. Option 3, apply heat and cold therapy to your right knee as needed. Option 4, place a pillow under your right knee while you are sleeping. Option 5, take prescribed over-the-counter NSAIDs to manage your pain. All right, 30 seconds on the clock. I'll give you a little bit longer because it's a little bit longer of a question. Drop those answers in the chat. And again, we have a select all that applies. So you're going to have more than one right answer. So let us know what you guys think. Good work, you guys. And a bunch of people passing their NCLEX. We're so happy for you guys. That's so great. Well done. Well done. Let us know what kind of nursing you're headed off to do now that you're officially licensed nurse. Good work, you guys. Awesome. It's so great to see so many new faces and our regulars as well. So we're glad to have you guys here. All right. I'll give y'all about 10 more seconds. Let's see what we got. Good work, you guys. All right. So our correct answers on this one are going to be options 3 and 5. So again, select all that apply. General rule of thumb, we're going to take a true-false approach to each option. We're going to look for the options that are safe and anticipated, indicated, things we should do for the condition. So when we are talking about osteoarthritis, again, we're talking about, a condition in our synovial joints. So think about our knees, our hips, our fingers. It can cause progressive erosion of that cartilage and the bone beneath it. So as that goes on, we're going to worry about bone spurs and calcifications in the joint space, and that's going to cause some pain, some deformity, and even instability. So a good rule of thumb for any of these conditions, kind of musculoskeletal, is going to be RICE. So rest, ice, cold or heat, and elevation. And then NSAIDs are definitely going to help reduce that inflammation. So that's what we're seeing in option 3. Applying, alternating between heat and cold, that's going to help with some of that pain, help with the inflammation, and also help promote blood flow. Option 5, NSAIDs are going to, again, work on that inflammation. It's going to help reduce that inflammation and ease that pain. For option 1, avoid splinting your knee, you have to pay attention to that word avoid. Splinting is kind of part of the C in compression, and that can provide some stability and also some pain relief. Option 2, we do perform weight-bearing aerobic activities regularly. We're going to worry about some pain and swelling, so we might want to rest when we're in this acute stage. When we're having pain, we're going to want to rest it, and then we can resume activity that doesn't cause us pain or discomfort or is safe for us. And then option 4, place a pillow under your right knee while you are sleeping. We typically would want to put that pillow under the feet to allow swelling to go down, not so much the knee. All right, good work, you guys. Last question. The nurse is teaching clients at a community health fair about prevention of back pain. Which of the following information should the nurse include? Option 1, lift heavy boxes using your arms. Option 2, avoid body movements that twist your spine. Option 3, pull rather than push when you are moving objects. Option 4, lock your knees when standing for extended periods of time. All right, 30 seconds on the clock. Let us know what you guys think. Good work, you guys. And thanks to everybody who shared this session. Before we're done today, too, we'll be live again tomorrow, Thursday at 3 p.m. Central Time. Samantha will be back going over antepartum questions. So kind of a little bit more involved than what we talked about on Tuesday with antepartum conditions. So come back and check that out. We'll go through those questions, get great explanations, and then we'll be back again live Tuesday at noon Central Time on all of our channels, starting kind of kicking off our week next week. So be sure you guys come back and let us know. All right, so our correct answer on this one is going to be option 2, avoid body movements that twist your spine. Again, whenever we see this question is a little, so okay, let me start over. We're looking for information we should include. So these are true statements that we want to tell our client. Sometimes when we see that word avoid, it's a negatively phrased statement. So we have to understand what the statement is trying to tell us. So twisting your spine is not indicated for clients that have back pain. So avoiding it would be a good thing to tell our client. This would be a true statement. So we definitely want to avoid that. That's not good body mechanics. We're really not meant to twist like that. What we're seeing in option 1, this is not something we would want to tell the client. We want to lift with our legs. We want to stabilize our core. We don't want to just use our arms. That's how we're going to hurt our back. For option 3, pull rather than push when you are moving objects. We want to push. We're going to have more strength and force behind us. And then option 4, you never want to lock your knees. That's how you become viral, because you fall over. So we do not want to lock our knees. That's not going to be good. And body mechanics and back pain prevention and just protecting your back as a nurse, especially a floor nurse when you're working 12-hour shifts, it's so important. So make sure you're always, doing everything you can to protect your back, using the bed to your, kind of moving the bed and getting someone to help you rotate clients. Those are all great things to do. So use all of that to your benefit. So good job, you guys. You did great. Let us know how you did out of 8. And as always, we hope you guys will come check us out at nursing.uworld.com. We have tons of great information for you guys, including blog posts. We have a lot of new social media content, including our Nurse Life videos, and of course, our free trial. Again, you guys can see what uWorld is all about and all of our different subscriptions. So we hope you guys will come check us out, and we look forward to seeing you guys tomorrow for antepartum questions with Samantha. See you at 3 p.m. Central Time. Thanks again, guys. Bye.